Research sites are heroes, but the volume and complexity of their regulatory work is not sustainable. Research teams spend an overwhelming amount of time tracking paper and working in various sponsor applications that simply aren't built for them. This leads to burnout, and sites are drowning amidst staffing shortages. On top of it all, inefficient processes and expensive technology make the costs of running research higher than ever, and study budgets often don't cover the expenses. There's a better way. SiteVault is a free, compliant e-regulatory application for sites created by Veeva. Veeva builds technology for sites, sponsors, and patients to advance clinical research and improve patient participation. We are investing in sites by providing free, high-quality software that makes it easier to run trials. SiteVault makes it simple to manage regulatory work across all your studies, regardless of the sponsor you're working with. In this demo, you'll see how you can use SiteVault to save time and reduce costs, work more seamlessly with sponsors, and relieve overwhelmed staff. Let's get started. I'm a regulatory coordinator who is managing several studies, and I recently took on a few more after a colleague left our organization. I need to quickly understand what's going on with the studies I inherited. Let's log into SiteVault to get started. My regulatory coordinator dashboard shows me the status of all of my studies and makes it easy for me to pick up where my colleague left off. First, I notice that there is work to do for the AVIG 027 study. There are several open training tasks, a draft document I may need to finalize before a monitoring visit tomorrow, and updates to the Delegation of Authority log in progress. I also have some new documents for this study that I'm not sure are filed yet. I need to get them filed for tomorrow's monitoring visit. I'm going to head to this study's eBinder to get started. Once in the eBinder, catching up on how my colleague has been filing documents is easy because all of our studies follow the same structure with standard folders, document types, and naming conventions. I don't need to guess which binder template was used for this study or how the documents are supposed to be organized and named. This standard structure even makes it easier to get my monitors up to speed. But for now, I have a CLIA and an interim monitoring visit confirmation letter I need to make sure are filed. I'm just relieved that I don't need to go digging around to figure out what's here and what's missing. I search and see the confirmation letter isn't yet in our binder. When I add the monitoring visit confirmation letter, it's automatically named and filed to the right location, so I don't even have to remember the exact folder to save it in. Later, if I have a lot to upload at once, like source documents, I can upload them in bulk and even certify them as copies in just a few clicks. The last thing I need to do here is to get my principal investigator's new CV finalized, which I can see here is still in draft. I'll send this to Dr. Bird to sign, right within SiteVault, and I'll give him a due date to make sure he knows when we need his signature. And done. Now the eSignature request has been sent. I know that Dr. Bird has been notified via email that his CV is ready for signature, so I don't have to wait outside his office to catch him between patient visits. And I'm glad I don't have to make the same updates on this CV for all the other studies Dr. Bird works on. CVs and other site-level documents like licenses, credentials, and lab certifications are managed just once in SiteVault. Any changes to these documents are cascaded across all the relevant studies. I don't need to file the same document more than once or worry about missing a study. I am confident that the latest updates are always filed. With initial prep for the AVIG 27 monitoring visit underway, I'm going to shift my attention to understanding what's going on with all those outstanding training tasks on this study, and make sure my study team hasn't fallen behind. My study overview dashboard helps me deep dive into what's going on with the activities on this study and follow up. First, I can see which staff members on the study team have outstanding tasks like e-signatures, approvals, and document training, and with insight into each team member's average task turnaround time. I know who might need an extra reminder before any delays or bottlenecks occur. Looks like Dr. Bird has been a little slow sometimes, but since we showed him this dashboard, he's gotten much faster. And oops, looks like I have some outstanding document training of my own to complete too. Fortunately, the dashboards in SiteVault don't just visualize data, they're also actionable. I'll click into the report behind the dashboard to identify the document I need to train on. I know that SiteVault will always provide the latest version of the document for training, so I don't need to worry about anyone on the team wasting time by training on an older version. As I complete my document training now, I use Version Compare to see what's changed in this new version, so I know exactly what I need to review. Once I confirm I've read and understood the changes, my training report automatically updates. With a clear and auditable training history, I can trust that my training log always stays up to date and make sure our study training gets completed on time. Before SiteVault, maintaining our manual training logs were a major headache for our team. Logs often went unupdated and could easily fall out of date, which made it hard for us to understand who trained on what and opened us up to compliance risk. In SiteVault, automating our training log in the same system where we complete training means no manual trackers, nor any of the associated extra work of maintaining them or risk of log inaccuracies. When I was looking at my regulatory coordinator dashboard earlier, I also noticed that this study had outstanding delegation log approvals. I'll go to my delegation dashboard to figure out what's needed to get the log finalized to account for a few new staff members who recently joined the team. Managing a delegation authority log has always been a challenge given the evolving nature of the document, along with the multiple stakeholders and approvals involved. But my delegation dashboard in SiteVault helps me keep track of the work I need to do to maintain my DOAs, with clear next steps so I can ensure each stays up to date. From here, I can quickly understand which DOA need attention, whether it's a staff member who needs to accept their responsibilities, or a PI who needs to approve assignments in bulk. Our AVIG 027 study has several delegations that need our PI approval, so I'll go ahead and send those off to Dr. Bird to approve. Although there are several updates to our log, Dr. Bird will get a single task to review all the changes together. As with the eSignature, Dr. Bird gets a notification when I send this request, so I don't need to send a separate email, chat, or even track Dr. Bird down to get their approval. With those delegations sent off to the PI for approval, I'll take a short break. While I'm gone, my PI Dr. Bird logs in and approves the delegations. Dr. Bird's tasks show up right on their home screen when they log in, so they don't need to go digging. And while they're here, they also sign off on their new CV with a fully compliant electronic signature. When I come back, I see that Dr. Bird has completed their tasks, and I'm relieved I don't have to chase them down or wait outside their office to collect signatures anymore. Let's check out the new version of my delegation log. Unlike paper logs I've worked with before, there are no messy strike-throughs or notes in the margins. I can clearly see the study team's current responsibilities, still maintain access to previous versions, and even compare what's changed over time, if I need to. Best of all, I never need to worry about it getting lost or misplaced. With our DOA finalized and my PI's new CV signed, I'll go ahead and make sure we're all set for tomorrow's monitoring visit. Fortunately, it looks like we're already in good shape. I can see that we have several documents ready in the monitor's queue to review. These are the documents that have been finalized in SiteVault, but not yet monitored. Even though I didn't need to manually compile this list of documents, I know that SiteVault will only show the latest, finalized versions of each document to my monitor, so I don't worry about the monitor reviewing an outdated version and can trust the monitor only sees what they need when they need it. I have the option to limit my monitor's access to a specified time frame, and rest assured knowing that SiteVault prevents my monitor from downloading sensitive information, like source documents. I also confirm that there are no draft documents that still need approval, and with that, prep for the monitor was fast and easy, and we're ready for the visit. My monitor tomorrow is new to this study, but Veeva provides SiteVault monitor training, and the monitor has monitored at other SiteVault sites before, so I know it will be a breeze. My monitor will get their own dashboard in SiteVault so they can self-service. Just like me, they can clearly identify the documents that need monitoring and check out the documents that our previous monitor reviewed, so they don't waste time remonitoring. Tomorrow, when the monitor reviews my documents, makes comments or asks questions, I can keep track of everything awaiting my response here. So whether my monitor is on site or across the country, we can collaborate in real time. With my monitoring visit prep all done, I'll turn my attention to consenting new participants. So far, eConsent has helped us reach a larger population of patients for this study, and we have a new approved consent version I need to finalize in SiteVault. Using the eConsent editor, I can add sections of text and format using rich text editing or expand on my content by adding engaging media such as photos or videos. I also confirm we've added new questions to our consent form. This will help us understand which participants are interested in participating in future research at our site. Signature blocks can also be added to dynamically show based on signatory requirements by patient. For example, we're going to collect a parent or guardian signature for all patients under 18. Once approved, I am ready to send my consent form to a prospective participant. When consenting a patient, I am confident that I am using the correct document because SiteVault always shows me the most current version. For patients, it is easy to review and sign consent forms through the intuitive MyVeeva for Patients. Patients have one MyVeeva account forever, even across other studies at other sites, providing a really seamless patient experience. MyVeeva can be accessed through iOS, Android, and web, and our patients can complete consent whether they're on-site at our clinic or at their own home. Unlike a PDF consent, where the patients need to endlessly scroll and can easily lose their place, the table of contents here will highlight which sections have been viewed, so the patient can make sure they've looked everything over. Our embedded video content supports patient comprehension, and as we track the patient's review, we can be sure content is fully understood before a signature is captured. Once signed, this document will be available within the Documents tab of the patient's MyVeeva app, so it's always accessible to them. The signed eConsent will also flow to SiteVault, where I will receive a notification that a counter signature is required. After I complete my counter signature, the finalized consent automatically files to my eBinder and is easily accessible for monitoring too. Now, I'll check to see if we have other participants who need to be consented as well. My eConsent dashboard makes it easy to understand which participants have consented and the consent version they signed, so I can be confident that we have the appropriate consents on file. It also provides visibility into the volume of consents over time on our study. This study has been particularly high enrolling and is only getting busier, so with this data, I make a note to talk to my director and point out we may need more staff to help out. As I move on from eConsent, I reflect that already today, I've filed a new document to my eBinder, collected an electronic signature from my PI, completed training on a new protocol version, finalized an outstanding delegation authority log, completed prep for tomorrow's monitoring visit, even finalized our new consent version and consented a participant. And I've done it all from SiteVault without going into email, another application, or even leaving my desk. The final thing I need to do today is send Dr. Bird's new CV to my study sponsor, and so I'll head over to Study Connect. This sponsor is one of more than 450 sponsors and CROs that already use Veeva clinical applications, and for this study, they've invited me to exchange documents with them through Veeva Study Connect. I already accepted their invitation, knowing that my site gets to remain in control of the documents we share and accept. Previously, I've connected with other sponsors through Study Connect for a few of my other studies too, and from here, I can quickly check to make sure those sponsors aren't waiting on anything from me or my team, without the need to check in each sponsor's separate portal or sift through my own email to figure out what's needed. I'll go ahead and share the updated CV. And it's quick because I don't have to endlessly search through files of unstructured documents trying to hunt down the right one. I easily find Dr. Bird's current CV and send it. Now, I review the other document requests from my sponsor and see they're looking for our recent IRB response. Even though we're working with several different sponsor contacts for this study, I know that any requests we receive from any of them all will show up here. As I open the request for the IRB response, I know SiteVault will use logic and present the most current version of it for my approval. Because my documents are filed to the document types in SiteVault Standard Reference Model, the correct document preloads for me here. When I send it over, it will automatically be filed appropriately in my sponsor's regulatory system, or TMF, as the appropriate document type, the same way the documents the sponsor sends to us can automatically file in our eBinder. I quickly provide the IRB response and move on. When I'm on vacation next week, my team can see a clear history of document exchange, so they don't have to duplicate work and resend documents I've already sent, and I don't have to worry about my sponsors' requests getting held up in my email inbox while I'm gone. I'm relieved that SiteVault gives my team the transparency to keep the work for my studies moving forward while I'm out, and know that it'll be easy to catch up on what's new after I take some much-needed time off.
As a site director, I'm worried about my team taking adequate time off so they don't burn out. I use my site management dashboard in SiteVault to understand staff workloads across my team. Though everyone tends to feel busy, reviewing actual work completed over time helps me understand who's at risk for burnout with too much on their plate, and who has extra bandwidth for the several new studies we have in our pipeline. My dashboard also helps me understand the volume of monitoring activity for my studies over time. Before SiteVault, I knew when my staff were overwhelmed, but I didn't always know why. It was really challenging to understand all the work that went into preparing and conducting monitoring visits, especially if monitors weren't on site. And without understanding that workload, we had a hard time negotiating and getting reimbursed appropriately. From here, I can get a clear picture of all the work that's going on over time so I can make sure the budgets and resources I have in place are sufficient. When there's a gap, I have the data I need to negotiate larger budgets for monitoring on my busiest studies. The last thing I notice on my dashboard is that our monitor has returned a disproportionate percentage of documents with comments during the first monitoring visit for the 029 study. I make a note to meet with that coordinator and feel confident we can address the issue before we get too far along in the study. With the right tools to support my research staff and ensure we have the resources we need, I know that I can be a champion for our research teams, and in turn, they can be champions for our patients.